Welcome friends, I'm Dr. Rajsree Nambudripad and today's video is all about histamine intolerance. Now I'm sure most of you are already familiar with lactose intolerance, which is where a person avoids dairy products like cheese, and gluten intolerance, which is when a person reacts to the protein gluten that's present in traditional wheat bread. But a lot of people are not familiar with histamine intolerance, which is what inspired me to make this video. In histamine intolerance, unfortunately, a person can feel like they react to everything. Awareness of histamine intolerance has grown in the last couple years, but it's still very possible that your doctor has not even heard of this condition. Sadly, in histamine intolerance, a person will react to a lot of foods that are typically considered healthy, like fermented drinks like kombucha or fermented foods like sauerkraut, which are loaded in probiotics. They'll even react to avocados, which are known to be a healthy source of good monounsaturated fats. So what are histamines? Histamines are compounds made by our immune system, specifically mast cells and basophils, which are types of white blood cells. These cells are armed and ready for battle at all times because they're packed with granules. When they get triggered, they release these granules, which are full of inflammatory mediators, one of which is histamine. So normally, histamine is actually an important part of your immune system, but too much histamine can cause symptoms. In histamine intolerance, the body can't process histamines properly. There's a combination of increased production and decreased breakdown of histamines, which causes it to accumulate. High histamine can cause a wide range of symptoms, and that's because there's 4 different types of histamine receptors, and they're located in organs throughout our body. In our brain, histamine acts as a neurotransmitter, and it influences our sleep-wake cycle. Too much histamine can cause insomnia, anxiety, headaches, dizziness, and tinnitus, which is ringing in the ear. In our stomach, histamine triggers the release of gastric acid. Too much histamine can cause acid reflux or heartburn. In our nose, histamines can cause sneezing, nasal and sinus congestion. On our skin, histamines can cause itching, as well as rashes like hives or eczema. Histamines cause blood vessels to swell, so it can cause flushing or swelling anywhere in your body. In the lungs, histamines cause constriction of the airways, which can cause wheezing or difficulty breathing. In the heart, histamines can cause palpitations, rapid heart rate, and even high blood pressure. Once again, histamines can act as a brain neurotransmitter. That's why too much histamine can trigger anxiety and insomnia, and they're also a big trigger for migraine headaches. Anti-histamines are histamine 1 receptor blockers, and that's why they often cause drowsiness as a side effect. In the stomach, histamine triggers the production of gastric acid, which is why too much histamine can cause acid reflux or heartburn. Acid suppressive medications like famotidine or Pepcid work by blocking the histamine 2 receptors on the stomach. Once again, histamines can cause a wide range of symptoms, ranging from nasal congestion to skin rashes. You might be thinking, histamine symptoms sound a lot like allergies. Well, yes it does. It turns out that the symptoms of histamine intolerance and allergies are actually very similar, but the mechanism is different and therefore the treatment is different. In allergies, your body is reacting to a specific food or environmental item. For example, when a person with a peanut allergy eats a peanut, this causes their immune cells to produce IgE antibodies that are specific to the peanut proteins. These IgE antibodies then bind to the mast cell along with fragments of the peanut allergen, and this triggers the mast cell to release its granules. This process is called degranulation, and remember, these granules are loaded in histamine. Anaphylaxis is a life-threatening allergic response where a person has an extremely high IgE-mediated response toward a specific food or environmental allergen. In this example, a person with a severe peanut allergy accidentally consumes a peanut. This causes the mast cells to go crazy and explode and release large amounts of histamines and other inflammatory mediators. This can trigger airway constriction that can be life-threatening. This is why it's so important that patients with anaphylaxis always carry an EpiPen. Because of the similarity in the symptoms, it's helpful to rule out allergies before diagnosing histamine intolerance. You can do this through a blood test that checks the IgE antibodies that are specific to common food and environmental allergens. The most common food allergies include wheat, dairy products from cow's milk, soy, eggs, peanuts, fish, tree nuts, and shellfish. Now let's get into the mechanism of histamine intolerance. Histamine is broken down by two important enzymes. The first is called DAO, which stands for diamine oxidase, and it's found in the lining of your intestines. The second enzyme is called HNMT, which stands for histamine N-methyltransferase, and it's found inside the cells of many organs throughout your body. In histamine intolerance, there's significant reduction in the DAO enzyme, and this is caused by inflammation and disruption in the gut microbiome. This is what causes the histamines to accumulate. Now let's talk about the production of histamines. Histamine is made from the essential amino acid histidine by an enzyme called histidine decarboxylase. This enzyme is made by the bacteria that are present in food as well as the bacteria in our gut microbiome. People with histamine intolerance have increased production of histamines by bad bacteria in their gut microbiome, which I'm going to get into more detail later. Because of the microbes that are present in food, aged and fermented foods have higher levels of histamines. This includes foods like sauerkraut, aged cheeses, aged vinegars, soy sauce, and even bone broth. Once again, it's the bacteria in these foods that are producing the histamine. Another category of food high in histamines is fish, especially canned or smoked fish like tuna or sardines. In fact, there's a type of food poisoning called scromboid poisoning, which is caused by fish that has not been stored properly and has an excessively high level of histamine. Scromboid poisoning can cause symptoms like nausea, vomiting, diarrhea, abdominal pain, headaches, dizziness, and rashes, but the good news is it's usually self-limited within 24 hours and it's treatable with antihistamines. Histamines are also the reason why some people get a mahi-mahi flush. Interestingly, fish are not only high in histamines, they also have inhibitors of the DAO enzyme. Just remember, the fresher the fish, the less histamine it'll have. Next, we have foods that cause increased histamine release by your immune cells. This includes citrus fruits like oranges and lemons, as well as strawberries. Although these foods do not contain high histamines, they cause your mast cells to release more histamines. Now let's talk about alcohol. Most alcohol are high in histamines because they're made through a fermentation process. Alcohol also reduces the activity of the DAO enzyme in the lining of your intestines. Finally, alcohol and histamines compete for the same enzyme called aldehyde dehydrogenase, which is involved in the breakdown of histamines. As you can see, there are multiple reasons why a person with histamine intolerance would not tolerate any alcohol. The bad news is that there are some produce items that are unsuspectingly high in histamines. This includes spinach, eggplant, avocados, and tomatoes. Now let's review the three mechanisms in how foods can cause symptoms in histamine intolerance. First, some foods are naturally high in histamine, like fermented foods like soy sauce. Second, some foods inhibit the DAO enzyme, like alcohol. Finally, some foods cause your body to release more histamines from the immune cells, like citrus fruits. Next, it's also important to be clear that there are three sources of histamines. There's food, your immune cells, and finally, your gut microbiome. Coming up, we're going to do a deep dive on why a disrupted gut microbiome can be a big root cause of histamine intolerance. Most people with histamine intolerance acquire this problem at some point in their lives. So what causes them to become histamine intolerant? One of the big root causes of histamine intolerance is disruption of the gut microbiome. If there's an overgrowth of bad bacteria in the microbiome, these bacteria can end up eating the DAO enzyme and increasing production of histamines. Interestingly, the number one most common symptom seen in histamine intolerance is bloating. That's because small intestine bacterial overgrowth, also known as SIBO, is a common root cause of histamine intolerance. So what is SIBO? Normally, your small intestine does not have a lot of bacteria, and the primary role of the small intestine is to absorb nutrients from your food. Most of the bacteria are located in the large intestine or colon. But if the bacteria from the large intestine back up into the small intestine, these bacteria are now in the wrong place, and they can cause a lot of bloating and discomfort. The good news is SIBO is a treatable condition, and I have a whole video dedicated to SIBO, which I'll link below. SIBO causes histamine intolerance by damaging the enzymes that are located on the lining of our small intestine. These tiny finger-like projections are microvilli on a cell in the lining of our small intestine. At the edge of these cells is something called the glycocalyx. This is a protective glycoprotein layer with enzymes that normally help with food digestion. Unfortunately, in SIBO, the bacteria end up eating the glycocalyx, and they also end up eating up the DAO enzyme, which is stored in the cells lining the microvilli. This is why SIBO can be a big root cause of histamine intolerance. Next, we have dysbiosis. Dysbiosis means there's an overgrowth of a bad bacteria, and it doesn't necessarily have to be in the small intestine, so it could be in the colon. Research shows that certain species of Morganella, Hafnia, Proteus, Enterobacter, Enterococcus, Citrobacter, Pseudomonas, and Lactobacillus ceramneri can produce higher levels of histamine from your gut. That's because these bacteria produce higher levels of that enzyme histidine decarboxylase, so they convert the amino acid histidine into histamine. Once again, this is why a disrupted gut microbiome can be a big root cause of histamine intolerance. You could also have dysbiosis with a fungal overgrowth like Candida. To learn more about Candida as well as small intestine fungal overgrowth, I have a whole video dedicated to this topic, which I'll link below. Another root cause of histamine intolerance is leaky gut, also known as abnormal intestinal permeability. Normally, the lining of your intestines is only a single layer thick, and the cells are bound together by tight junctions. These are the cells that carry the DAO enzyme, and they normally break down histamines before they enter your bloodstream. In leaky gut, there's disruption in the tight junctions between the cells, so histamine can go straight from your food into your bloodstream. On top of that, food particles and bacteria can enter your bloodstream, triggering immune dysregulation, which can cause autoimmune disease, and it causes your mast cells to release more histamines. To learn more about leaky gut, please check out my video, and I'll share the link below. Next, inflammatory bowel disease, which consists of Crohn's disease and ulcerative colitis, is also associated with histamine intolerance. These are autoimmune diseases affecting the intestines, and they are strongly linked to dysbiosis and inflammation, which can impact the DAO enzyme as well as the production of histamines by the microbiome. Histamine intolerance is also associated with irritable bowel syndrome, or IBS. What's fascinating is research shows that the histamine levels correlate with the severity of the abdominal pain. IBS is just a label for the symptoms, but it turns out that SIBO is a big root cause of up to 70% of IBS. Remember, SIBO bacteria can eat up the DAO enzyme on the lining of the intestines. Next, we have gluten sensitivity. About 8% of the US population is gluten sensitive, meaning they feel better when they avoid gluten from their diet. Research shows that non-celiac gluten sensitivity is associated with a DAO deficiency and hence can be associated with histamine intolerance as well. Before we move on, I want to emphasize that a big root cause of histamine intolerance is a damaged gut microbiome. That's because the bad bacteria can reduce the activity of the DAO enzyme and increase production of histamines. There are also genetic causes of DAO deficiency. In fact, over 50 SNPs, which are genetic mutations in the DAO gene, have been identified. Now let's circle back to the symptoms of histamine intolerance. People with histamine intolerance often get symptoms right after eating foods that are high in histamines. If you're noticing that certain foods give you a runny nose or make you anxious, these could be symptoms of histamine intolerance. So how do we make the diagnosis of histamine intolerance? The first step is to rule out allergies. You can do this through a blood test that measures the IgE antibody level specific to all the food and environmental allergens. Unfortunately, at this time, there's no accurate blood test, stool test, or urine test to diagnose histamine intolerance. Intestinal biopsies to measure the DAO enzyme activity, which can be done during an endoscopy or colonoscopy, is still in research phases. The gold standard of diagnosis is a low-histamine diet. If you follow this diet for 2 weeks and your symptoms improve, then we can make the diagnosis of histamine intolerance. Let's review the foods that you have to avoid on a low-histamine diet. First, we have aged and fermented foods like sauerkraut, soy sauce, aged vinegars, cheese, alcohol, as well as processed or cured meats. You also want to avoid canned or smoked fish. Produce items high in histamines include spinach, tomatoes, eggplant, avocados, bananas, pineapple, as well as mushrooms. Histamines are also found in legumes like soybeans, lentils, and peanuts. You also want to avoid strawberries as well as citrus fruits like oranges, because these fruits can increase your release of histamines. Finally, coffee, black tea, as well as chocolate could also be a problem for many people with histamine intolerance. Interestingly, apple cider vinegar seems to be tolerated in histamine intolerance, even though other aged vinegars are not tolerated. Being on a restricted, low-histamine diet is hard, and some people get overwhelmed not knowing what to eat. The good news is the low-histamine diet is just to make the diagnosis of histamine intolerance and to manage your symptoms, but ultimately it's not the treatment for the condition. Ultimately, the treatment is to address the root cause, which is often a damaged gut microbiome. Let's go over a couple more tips for the low-histamine diet. Because histamine is made by the microbes that are present in food as it ages, you want to eat fresh or frozen only. This is why you want to avoid leftovers that have been kept in the refrigerator. If you're meal prepping, the best thing to do is to freeze your food. As far as cooking methods, you want to avoid slow cookers as well as frying or grilling, because these methods could increase the histamines in the foods. The good news is that boiling or pressure cooking seem to be fine and do not increase histamine levels. Another helpful tip is if you have a flare-up of your histamine symptoms, you can often feel better quickly by doing a short period of fasting, where you just drink water. This gives your digestive tract a break and allows your body to focus on clearing out the histamines. If you feel so much better on a low-histamine diet, this confirms the diagnosis of histamine intolerance. The next step is to address the root cause and heal your gut. The good news is we can run some tests to figure out exactly what's going on in your gut microbiome. If you're having a lot of bloating, we can diagnose SIBO with a SIBO breath test. There's also a stool microbiome test that can tell us if you have inflammation, leaky gut, dysbiosis, candida overgrowth, parasites, or an infection with H. pylori. The good news is we can use herbal antimicrobials to clean up the microbiome. This includes berberine, which comes from the root of the berberine plant, oregano oil, which comes from the Mediterranean herb, and alicidin, which has the antimicrobial compounds from garlic. These herbal antimicrobials have anti-inflammatory benefits, and they work for a wide variety of gut issues, including SIBO, CFO, which is small intestine fungal overgrowth, dysbiosis, as well as candida overgrowth. To heal leaky gut, we use the amino acid powder called L-glutamine, which is food for the cells lining your intestines, which are called enterocytes. We can also use a supplement called IgG Guard, which is dairy-free immunoglobulins derived from bovine serum to help rapidly heal inflammation in the gut. In leaky gut, it's also important that you clean up your diet. This means cutting out refined sugar, gluten, dairy, alcohol, and vegetable oils. It's also important to avoid non-steroidal anti-inflammatory drugs like ibuprofen, which can often worsen leaky gut, and to manage your stress to help promote gut healing. Now, what about the use of antihistamines? Well, that's a great question. Let's dive into it. The great news is we carry a natural antihistamine called histamine support, which has natural ingredients like quercetin, vitamin C, stinging nettle, bromelain, and NAC. These ingredients help to stabilize mast cells and reduce histamine release. It's best taken at a dose of 2 capsules twice a day. If needed, over-the-counter antihistamines can also be used short-term. This includes histamine 1 blockers like loratadine, which is Claritin, or cetirizine, which is Zyrtec. Histamine 2 blockers like famotidine, which is Pepcid, reduces the production of stomach acid, so it can be used to treat heartburn or acid reflux. It's best to avoid using these medications long-term because otherwise when you stop them, you may get a rebound increase in histamine production. Digestive enzymes can also make a big difference in histamine intolerance. Our Digestive Enzyme Pro helps to target the breakdown of proteins, fats, and carbohydrates. This can help to prevent bloating as well as to reduce inflammation in the gut. We also carry vegetarian digestive enzymes. You can also supplement with the DAO enzyme. It's typically made from porcine kidneys, and I'm excited to announce that I'll be carrying it soon in my supplement store. What's fascinating is there's a natural food source of the DAO enzyme, and it comes from sprouted legumes. Keep in mind that not everyone can digest legumes, but if you can, then sprouting peas or legumes, especially in the darkness, is a great way to get a natural food source of the DAO enzyme. It's also helpful to give your body some of the cofactors for the DAO enzyme. This includes vitamin C, B6, which is found in our methyl B complex, magnesium, as well as zinc and copper, which are found in our multivitamin. Next, we have vitamin D, which is very important for immune regulation. So you'll want to supplement with vitamin D3 with K2, either in capsule or liquid drop form, to get your blood level optimized to a goal of 60 to 80. Now you may be wondering about probiotics. Great question, let's go over it. Research shows that there are higher levels of a good bacteria called Bifidobacterium in normal people compared to those suffering from histamine intolerance. There's also a good probiotic yeast called Saccharomyces boulardii or S. boulardii, which has been shown to improve the activity of the DAO enzyme. Our probiotic 20 billion, as well as our probiotic 100 billion, has Bifidobacterium as well as multiple good strains of lactobacillus to help with dysbiosis in the gut. You can also try S. boulardii just by itself, and our probiotic 20 billion also contains S. boulardii as well. There's a lot of literature showing that S. boulardii can help with IBS symptoms, and it also helps to prevent the growth of other bad yeast like Candida in the microbiome. The good news is as your gut gets healthier, the cells lining your intestine will produce more DAO enzyme, which will lead to better histamine tolerance. This is when you can gradually start reintroducing histamine-containing foods, and hopefully now you'll be able to tolerate them much better. You also want to avoid DAO blockers, which include many common medications. Believe it or not, ibuprofen and other common non-steroidal anti-inflammatory drugs, as well as common antibiotics like Augmentin, can block the DAO enzyme. In the description below, I'm going to link a review article that has a table listing the many other medications that can also block the DAO enzyme. Now let's talk about histamines in women. For you men out there, please stick around. You may find this information interesting. High levels of histamines can actually cause bad menstrual cramps. Unfortunately, this is an additional symptom that women with histamine intolerance can experience. If this is the case, taking an antihistamine at the start of the period can help reduce the cramps. This is a graph showing the hormones in the menstrual cycle. What's fascinating is histamine levels correlate with estrogen levels. Estrogen is more dominant in the first half of the month, called a follicular phase, so this is when women experience more histamine symptoms. Close to ovulation, there's a peak in both the estrogen levels as well as the histamine levels, and this can trigger migraines in some women. In the second half of the menstrual cycle, called the luteal phase, we see a rise in progesterone, which correlates with a rise in the DAO enzyme. So women with histamine intolerance will typically have less symptoms in the luteal phase of their cycle. Unfortunately, because progesterone levels drop right before the menstrual period, this can cause a rise in the histamines, which can cause the bad menstrual cramps. What's really amazing is that histamine intolerance improves during pregnancy. This is because pregnancy is a high progesterone state, but also because the DAO enzyme is actually made by the placenta. In fact, DAO levels can be up to 500 times higher during pregnancy. Another cool fact that I wanted to point out here is this pregnant lady is holding an apple, and apples are a great source of quercetin, which is a natural antihistamine. Histamine levels also vary along with our circadian rhythm, which is our sleep-wake cycle. Typically, histamine levels are higher during the evening and nighttime, so you may notice that certain foods affect you more when you have them for dinner as opposed to breakfast. Now I want to introduce you to two other conditions that are similar to histamine intolerance but a bit more severe. The first condition is called mast cell activation syndrome. It has symptoms very similar to histamine intolerance but often more severe, episodic, and not always connected to food. It's thought to be caused by a hyperreactive immune system that's been triggered by an infection or toxin exposure. Possible root causes include many of the gut conditions we talked about, such as SIBO or dysbiosis, but it can have other triggers as well, such as Lyme disease and viral infections like Epstein-Barr virus, cytomegalovirus, herpes viruses, varicella, even long COVID. It can also be triggered by exposure to heavy metals and molds. What's fascinating is research even shows that exposure to EMF, which is electromagnetic fields, can activate mast cells in sensitive individuals. To diagnose mast cell activation syndrome, you want to measure the blood levels of an enzyme called tryptase, which is often elevated during a flare. The treatment for mast cell activation syndrome is similar to the treatment for histamine intolerance in that you want to address the root cause, which often involves healing the gut or addressing any chronic infections. Next, there's a condition called systemic mastocytosis. This is a more serious hematologic condition where mast cells start multiplying and can infiltrate your bone marrow. It can also cause enlargement of your spleen, lymph nodes, and liver. In systemic mastocytosis, the blood level of tryptase is elevated all the time, regardless of symptoms. This is a condition that needs to be treated by a hematologist, which is a blood specialist. Now, returning to histamine intolerance, I want to emphasize the good news. Histamine intolerance is a treatable condition, and healing the gut is the key to restoring your DAO enzyme. Now I want to introduce you to one of my patients named Tony. When Tony first came to see me, he was having a lot of symptoms, including food intolerances, anxiety, insomnia, rashes, headaches, and sinus pressure. Interestingly, all these symptoms began in October of 2021 when he also noticed a shift in his gut health. That's when he started having constipation, occasional episodes of diarrhea, as well as bloating. When I tested his gut, I found that he had both SIBO and leaky gut. Over the next couple months, we worked on treating his SIBO and healing his leaky gut. Tony was extremely committed to his health and did a wonderful job in following all the protocols. The amazing news is as his gut healed, all his other symptoms went away. So Tony had a classic case of histamine intolerance that was causing this wide range of symptoms, and it was all due to a damaged gut that was affecting his DAO enzyme. Many of the supplements, like histamine support, as well as the cofactors for the DAO enzyme, improved his symptoms, but ultimately it was healing his gut that improved his quality of life dramatically. The best part is he was able to go back to eating all his favorite foods, like spinach salad, pizza, coffee, and even an occasional alcoholic beverage. Thank you, Tony, for inspiring me to make this video and for allowing me to share your story. So here are the key points. Histamine intolerance can cause a wide range of symptoms. Histamine is found in many foods, but especially aged and fermented foods. Having lower levels of the DAO enzyme due to a damaged gut is a big root cause of histamine intolerance. The gold standard of diagnosing histamine intolerance is if your symptoms improve on a low-histamine diet. But ultimately, the treatment is to heal your gut so that you can restore your DAO enzyme and reintroduce foods. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. Please leave all your questions and comments below. I look forward to hearing from you. Thank you again and have a wonderful day.